particular interest I have in being here is that technology in the care home environment has a kind of a different angle from the technology as in telecare and telehealth. And before I just introduce ourselves more, I thought I would just go through and actually very quickly give you the sort of fundamental reason why maybe it needs a different angle in care homes. Given that in the care home environment, unlike people's own homes, staff are already available by definition. It's a care home after all, and care should be there and is there to assist, supervise, monitor constantly. So it's a different landscape. And also, quite rightly, the residents that we would have in our care homes are people who would with great difficulty be able to be looked after even with technology in their own homes, and therefore those really relatively high levels of disability impair their ability to use technology very often. But what we're going to talk to you about today is that technology, in our view, can assist with social needs just as much as with those physical sort of health needs that traditional telehealth and telecare addresses. And aligned to that in the care home environment, actually with that intensity of staff that's available there, high quality care to be able to be consistently delivered, every outcome that matters does need to be measured in some shape or form, and technology is a great help to help us do that. So, let me just tell you a little bit about us. As Anna's already introduced, we're in the southeast only in Surrey, Kent and Sussex. And we have made a fair bit of investment, not so much in pounds and pence to be honest, but more in terms of our culture and attitudes and effort into e-technology to improve care outcomes. There's three today we're going to focus on in particular. Firstly, electronic care plans and daily reports, accessible online and have been for a few years. Brilliant to hear what the GP was saying a little while ago about paper records being a thing of the past. Then just using that nurse call infrastructure that's in virtually every care home and allowing that to measure some outcomes and significantly to reduce risk. And then mainly, what the little sketch is going to be about, a bespoke social networking system that we developed last year, and thanks to CETA, the South East Health Technology Alliance, for helping us with the funding for that project. And soon, which I'll come back next year hopefully and tell you about this one, barcoded medication with web-based records that we can see just how long every drug round did take. So, in terms of just first of all, and this is a quick whiz through electronic care plans, daily reports, we've used a really basic off-the-shelf package. The technology is very, very well established. Probably the package was written, I think, about 15 years ago. It's how we use it and how it changes practice on the ground and gives the opportunity for whoever delivers the care on the ground to write that up on the records and to overcome those supposed barriers that care workers are supposedly not very good in typing in records, which we very much disagree with. Anyway, once you just go over that little fundamental step, suddenly you've got records that you can read and that are all date and time stamped and provides a very clear audit trail and helps us to demonstrate just the outcomes that have been delivered. And then care plan reviews, rather than being hidden away in a myriad of paper files and all sorts of filing cabinets, can be actually monitored and reviewed electronically as a regular part of our management reporting system. Because our belief is, if we're going to get properly personalised in the care home environment, it's all about getting those care plans right and constantly personalising them and reviewing them. Residents' needs don't stay the same, so our care plans cannot stay the same either. And then, obviously, in the social care environment, unlike, again, the health environment, we're developing a relationship with our residents for a number of years, not a number of days or hours as in A&E. So in that case, their social network becomes really important to their well-being. And therefore, it's really important for us to engage far more with friends and family, particularly as they're living in all parts of the country or the world, and so we need to share with them just how Mum is. So we've got a web link allowing our records to be securely accessed by residents and their families, and then also to be part of the story as the care plans are updated, that those friends and family can be automatically emailed just to alert them that the care plan has changed, and inviting them to go and just see exactly how it has changed and to comment back to us if they have concerns. So just a screenshot really of the website. Any of you can go in and have a look at this at any time. Obviously, just a little plug at the top, it is trademarked, so you can't use it. But we're trying to be relationship centered in all we do. And this is just part of trying to be relational, not just with the residents themselves, but with the friends and families. So this is just a generic example of the sort of reporting that can be read in the privacy of one's own home about one's mum or gran. And similarly, care plans available for appropriately authorised person, that you can just always see what the latest one is and evaluate every time one's updated. So that's very, very quick whiz through electronic care plan and daily reporting. The second thing, I thought I'd just give you one on this concept of managing risk. And one of the highest risk kind of times in any care environment is nighttime, when most of us are sound asleep. And that's a time when obviously there's lower staffing levels, and those staff that are there have less supervision. And so what we've sort of looked at is we've got the technical infrastructure in a pretty basic way there in every home where residents can call staff when they're needed. And that creates a lot of data also, but what we do is we have staff press like the green button every time they enter a room just to validate that they're there as well. And then all that data that gets generated can be very cheaply and easily just streamed into a bog standard PC. And then that data can be downloaded into a report every morning so that we can see exactly the whole scheme of where the staff have been during the night. And the way we've just worked it, it just demonstrates, I want to demonstrate to you, this is not really about spending money or using expensive technology. In our case, it is a really boring job to download that data every morning. So we have actually outsourced that, and we have our administrative assistant, who we haven't met yet, who lives in New Delhi, who does that work for us every day. And Amar Singh, he's great. And on the 13th of March, his email was sent at 8:30 to the home manager in that case. It's a home in Woking. And what he did was he sent this really simple spreadsheet. This is just an extract that from 2000 hours the previous evening to 7:59 that morning, in other words, only half an hour before the email was sent. This is a outline for the managers to where the staff have been all during the night. So it's a great sort of validation of care outcomes, helps us to reduce risk, and I can assure you significantly changes behaviour on the ground. But we want to just talk to you mainly today about the social networking system. Obviously, social media is a huge part of all our lives right now, and can be a big part of our residents' lives as well. Again, if we bring together just the simplest of technology and open up channels that engage our residents with those social networks that are the most important to them. And so we've developed with CETA funding, George James Software, and I think George is here somewhere today, a system that's really a private messaging system, because security is really, really important. That's why we couldn't just use Facebook, for example, or we felt anyway, in this context anyway, for residents, friends and family to be constantly connected to their loved one. And this uses both SMS texting, as we're about to see, and online messaging through that same web portal that each one of our homes has. So what we're trying to do is drive all the traffic, the e-traffic, through that sort of web entry point for not just that online care planning and daily reporting, but also social networking as well. So in a way, if you just think about it in simple terms, the care planning and daily reporting doles out our residents' information to their nearest and dearest, but we're on the case of those nearest and dearest, and we want to hear back from them so that they can continue to socially support their mum or gran or whatever. So what we're just trying to do using the principles of social networking is to encourage friends and families to share their day-to-day lives with residents, and residents therefore are supported by dedicated what we call social assistants. So this actually does change. It's not about the money or the capital cost that the previous guy was talking about. It's a revenue rejig on how we work with our staff. Social networking can be applied perhaps in innovative ways we didn't think about. And for us, the big thing is that residents need to stay connected to their friends and family. So just in summary, I don't know why that thing's on the screen. Why in the care home environment, technology can be used to promote more personalised care planning and review, and much more transparently and constantly been able to rejig things in line with the residents' need. Improve consistency of care delivery. You might have a nice band of night staff on tonight, but what about tomorrow night and the next night and the next night? And do things get slacker over time? So this is just one way of, without being Big Brother, improving staffing supervision and reducing ultimately risk to residents, and but all to enhance residents' well-being through improved communications with friends and family. Thank you very much. Just a really quick broad brush run through.